Welcome again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Ian and once again joined by Dr. Clifford Yudelman from OptiSmile, ready to take a deep dive into the world of dental care from a consumer's perspective. If you're looking to brighten your smile or just protect your wallet, we've got you covered with practical advice and the latest insights. So stick around for the next couple of minutes as we uncover the secrets to maintaining both your dental health and also your finances. Big welcome to you once again, Dr. Yudelman. Are you well?
I'm well, thank you. I hope you had a great week and thanks for having me back. And very excited. We got great response to our last two episodes on digital. There may be a little bit of overlap, but we're going even deeper. Some of the questions might sound similar, but people want to know as much as possible, so they know whether it's worth seeking out a digital dentist. We've trademarked our tagline, leading digital dentists, and that's under trademark because we feel so strongly about digital dentistry. We want to make it part of our name, part of our branding, and it's our tagline. So OptiSmile, a leading digital dentist, coming to you soon.
That's it. And Dr. Yudelman, I want to ask you, now that we're talking about digital dentistry, the final edition, how does it improve communication between me and my dentist so that I really understand what is happening?
So in two ways. Last week we spoke about how the digital dentistry provides clarity. Instead of relying on abstract explanations, we can scan and look at the scan results and the digital images, and it's kind of a show and tell. You can see the exact areas that need attention and why. It's not just me saying there's a cavity here. You can actually see it for yourself. And, this visual proof, fosters transparency and trust, and we're on the same page. So we spoke about that. That's like co-discovery and co-diagnosis. We're both looking at the same screen. But with digital smile design, I often, instead of trying to catch up with a patient on a Zoom or a Google Meet, I'll use a screen recording software. It's called Vidyard, and I'll make a short video for the patient once I'm finished with their design, or the lab has done their design for their veneers or their injection molding. And then I share the link with them on WhatsApp, and they can watch it. They can show it to their partner. But the digital dentistry improves the communication about the treatment that you're proposing to do. And then it also obviously enhances the final treatment. So you get to see why you need it. You get to see what it will look like or what the dentist is talking about beforehand. And then we actually get to use all of that when we do it. And you can actually compare all of those scans. You can see that you reached the situation that you were looking to reach.
Okay, and in terms of durability, Doctor, are these advanced materials and 3D printed restorations just as strong as the traditional ones, or are they actually stronger?
Yeah, quite amazingly, these resins, ceramic resins that we're looking forward to, they 60 or 70% filled with ceramic, but they got a much better fracture resistance to better than ceramic. We've been using something called Emax since 2007, and it's unbelievable, but you do have to drill away a bit more tooth because you need 1.5 millimeters of space. With these 3D printed materials I mentioned last week, we can go as thin as 200 or 300 microns. So that's literally see-through, and we can build up the tops of teeth. And the research over the last 3-4 years finds them to be even stronger. The milled ceramics are brilliant, and they all undergo testing, for strength and flexibility and biocompatibility. And not only are they robust, but they also match or exceed the longevity of many of the traditional materials, like old-fashioned porcelain and metal crowns, and some of the regular composite fillings. What we're looking forward to most, aside from printing veneers and onlays, is actually printing fillings. So if someone comes in and they need 3 fillings on the top right and 3 on the bottom right, we can actually clean out the cavities. And then instead of spending another hour putting these fillings in one by one and building them up and shining a light and getting the size and the shape right, we can just do a quick scan, and the patient can walk down, watch the printer with us, and in 10 minutes we can print 6 or 8 or 10 fillings, take them out of the printer and glue them into place. So we're looking forward to it not only being better and stronger, but quicker, which is very exciting.
Amazing. And then, if I need a major procedure like a root canal or an implant, how do digital workflows help me recover faster or with fewer complications?
Going back to our podcast we did about CBCT scans, and we've done on implants, with the digital imaging, like the CBCT scan, which is a little mini CAT scan, we can map out your tooth's exact structure or your bone, the jawbone. So one of the resins that we have received is our 3D printing resin for doing surgical guides. So with a 3D print, or should I say a 3D scan of your jawbone, we can superimpose that with our special software with a 3D scan of your teeth, and then we can plan what your new tooth will look like, and then plan exactly where the implant needs to go, and then print a guide which clips over your actual teeth. So we'll now be able to do that all there in one appointment. So if we've got someone from overseas, listen to our podcast about dental tourism, but we'd be able to see you, scan you, do your x-ray, design the guide, print the guide in about 15, 20 minutes, while you're getting numb, flip that guide over your teeth, guide exactly where the implant should go in 3D, into where it needs to be in the exact position in your jawbone. And we can even print your temporary crown if we're going to put a temporary on at the same visit. That directs the drill to the correct angle. There's less guesswork, minimize the trauma around to the surrounding tissues. There's faster healing, so many other benefits. And for root canals, doing a root canal, especially on a molar without a CBCT these days, it's just becoming unheard of. If you don't have a CBCT in your dental practice and you're doing molar root canals, a lot of dentists are now starting to refer the patients to a colleague down the road for a CBCT. These machines are expensive. We've been getting quotes for our franchises. They were about 2 million rand. Fortunately, they have come down. They're about 1.5 million rand now. And the 3D scanner, the iTeros, are around about anywhere from 750 to 900,000 rand. And then some new ones that just got launched. Yeah, so a lot of the time when you're paying the dentist, it's not only for the time or for the materials at the time, but it's also so that the dentist can make the payments on all of this fancy equipment, which they're getting for your benefit. Which is why I love these. This talking about the digital dentistry, because it does shed light on what's out there and what's available. But it's a bit of a catch-22 if a dentist is stuck in a bit of a rut with just only billing at medical aid rates, or has patients that really can't afford to spend on anything more than a old-fashioned silver filling on their tooth. They never get to get or have the income to buy these types of machines, and that's why the OptiSmile franchise model will work so well for younger dentists that have, say, 6 to 10 years experience and just need the equipment and the know-how. That's where we'll come in, and we're looking to spread the word.
Very, very exciting stuff, Dr. Yudelman. I also want to ask you, if I'm wearing aligners or braces, can digital tech track my progress in real time to then fine-tune my treatment more quickly?
With braces, I'm not too sure. In the US now, very few orthodontists even do braces. Everyone's doing Invisalign or some kind of copycat aligner. Most of the copycat aligners don't have the tech that Invisalign has. So I can talk about the Invisalign system. We've done 6 podcasts about Invisalign. The thing that I'm going to talk about here to answer your question is something called progress assessment, where if we've got a clin check, which is your Invisalign plan up on the screen, and you come in and you're on aligner number 9 or 14, for instance, and you've been changing them properly, we can look and we can eyeball it and we can see, oh, your liner's fitting nicely. But what we do, usually around about liner number 8 or 9, is we take a new scan of your teeth and we tell it that you're on aligner number 9, and then it pulls in your treatment plan off the cloud, and it compares where your teeth are supposed to be with where your teeth are now. And it does very precise measurements, and it color codes everything. And it shows us which teeth are moving exactly according to plan, which teeth are moving very well, but maybe not exactly according to the plan. And then it will also pull up and tell us teeth that aren't moving. So you don't get all the way to end of your liners, number 14 or number 20, whatever it is. Your teeth haven't moved where they're supposed to. And there are special pliers and instruments that we can use just to make an extra little dimple on your liner and push a tooth a tiny bit. So when you put your next aligner in, it's caught up. Yeah, look, I don't know how people manage without these progress assessments. It reduces the failure rate, or should I say, the rate of having to get additional aligners. You got peace of mind. We're monitoring each stage. We also have, in terms of digital tracking, we've got virtual care. The patients get a special thing that goes with their phone, and they send pictures every time they change an aligner, and it actually tells us with AI how your teeth are tracking. So there's no surprises. Yeah, there's so much. It's hard to actually fit it all into 3 podcasts.
That's amazing. I'm just sitting here, just listening, and I'm in awe. It's amazing what is possible nowadays. Anything is possible when it comes to dentistry. Yeah. But okay,
isn't it amazing that after 54, what's this podcast number 56 now? That
yes,
after 56 podcasts, we've still got things to talk about. Who knew?
Yeah. Yeah, I was a bit worried there for a minute. We're going to start running out of topics. But what a world! I mean, there's so much to talk about. Dentistry is incredible, especially when it comes to the future and the technological advances. But my next question to you, Dr. Yudelman, if I've had digital scans already, can these be compared over time to spot changes in my teeth before they actually get serious?
Brilliant question. Absolutely. One of the greatest advantages of digital dentistry is we can save and compare scans over the years. So we would take photos. I opened OptiSmile. This year's going to be 10 years, and we've always done full set of photographs on the first visit, and patient comes in and says, I think this tooth is moving, or I think this gum is receding. And we go back to the photos from 5 years ago, or in some cases 8 or 9 or 10 years ago, and we can kind of eyeball it. But with a 3D scan, we can overlay the first scan with the second scan, or even 3 or 4 scans, and then the software will do a time lapse, and it will actually give us a little heat map. It will show if your gum has receded with a color heat map, or it will show if your tooth is worn down. And we've had quite a few surprises with patients that drink a lot of hot water with lemon. All of a sudden we look and we see, it looks like you may be getting a little bit of erosion, and we scan them. Ooh. And we overlay it. And we found one patient in particular, he lost almost 1 millimeter of enamel all the way around his tooth. And this is a great story, because I actually had models he had some injection molding on other teeth, and the composite resin didn't melt or should I say erode away. And I made new molds on the original models of where his tooth was before. And he came in, and we actually regrew or re-added to his tooth with composite exactly where his tooth was from a scan that we had done a year before. I don't know if I'm making myself clear, but I mean, that is pretty amazing.
It is.
So once you go to a dentist, like if you come to us and we've got a 3D scan of you, and even if we don't print the models, but we have a digital record, say you go overseas and something happens, maybe you have a skiing accident, touch wood, that never happens. If a tooth breaks, we could send that scan, either if you're here, but say you were overseas, we could send that scan over the internet. A dentist can print a model, make a mold, put that mold over your tooth and inject composite resin or 3D print something and glue it on, and your tooth can be exactly the way it was before. It's almost, I just finished listening to a book called The Synchronicities Nearer. The guy wrote the book, Kurzweil wrote a book in 2005, The Synchronicities Near, and now he's done an update. And he's talking about 3D printing, new organs and little nano robots. It's an amazing book. But, when I think about some of the stuff that we already do, it's already amazing.
Wow. And I love the time lapse and things because, when you look inside your mouth also every single day, you don't necessarily see that your gum line is receding. You don't always notice it, So if you can go back to photos of 5 years or even more, I'm sure a lot of people will be shocked to see what actually changed in their mouth without them even noticing.
Yeah, the main thing we see or we use it for is we get patients come in and we see that the edges of their canines are wearing down, and we question them about grinding, nighttime grinding. We've done 2 or 3 episodes on that, and they deny that they grind their teeth, and we tell them we should make them a 3D printed bite splint to wear at night to protect their teeth, something called a Michigan splint or similar, not just a rubber mouth guard, but like a hard plastic a special bite plate to stop you from wearing down your teeth. And maybe they're not so keen, and a year later we scan them and it overlays, and they can see that the next tooth over, which didn't have wear, now that's grinding down and it's already lost, say, 0.5 millimeter. I mean, sometimes it's quite shocking. And then you can say, you've lost this much in a year, so where do we think this is going to be in 5 years' time? And a lot of time, those patients want to get those crooked teeth straightened and bonded and get a bite plate like we told them in the first place. So, I wouldn't call it a sales tool. It's more about educating people. And also, people have to be in the right mindset and has to be at the right time for them. And there's always other things to consider, like finances. A lot of this fancy 3D dentistry doesn't come cheap because of the cost of the materials and equipment, but it is unbelievable, and it's replaces what nature gave us in the closest possible way.
And doctor, for those who are a little concerned maybe about safety, any hidden downsides or risks with digital dentistry that we should know about?
I mean, the first thing, like I just said, is these digital systems can be costly for a practice, which definitely affects treatment fees. If you go to an old-fashioned dentist that just has a few drills and some amalgam and a few old-fashioned tools, they don't have very big overheads. They're going to work quickly. They're going to put something in. It's worked for many, many years, but you're not getting the latest. The other thing is the technology relies on calibration and updating, and sometimes a newer and better scanner comes out. I mean, unfortunately, that happens all the time. And then you got to maybe sell the one you've got or swap it out for the next latest and greatest. And then there's software like the cloud special secure Poppy and HIPAA secure cloud storage and software, costs 8,000 Rand per month per scanner. So that's added in. Some of these other softwares are on subscription. So there's a lot of added costs there. And, not every clinic invests equally in training. I did mention, the investment that we're making into the 3D printing training. There's a training here locally, which I'll be going to, and one of my other dentists, that's 12,500 Rand, and the other 2 trainings, which are 18,000 Rand each, that's out of the US, it's online. So there is a downside, and the downside is the patient in the end pays for that by sometimes a higher fee to do something that's modern and quick and what you'd think would be cheaper, but there's other hidden costs. But, the downsides are generally outweighed by the improved accuracy, the comfort, and the transparency that the digital dentistry provides. Some of the things don't have an incremental cost. So At OptiSmile, our initial exam fee, which most dentists they charge for an examination and x-rays, we actually include the digital scan, the Invisalign outcome simulation, the photos, and the CBCT at no extra charge. So while there are dentists in Cape Town that might quote lower for an initial exam, you come to OptiSmile, it's an hour and a half, and you don't walk out. You pay what we quoted you for an hour and a half visit. And if you walk out and we've done all these scans, we don't charge extra, whereas there are dental practices that won't quote you up front. And then when you're in with the dentist, they say, oh, we need a scan for this, or we need an x-ray for that. And we've had patients come here and tell us that they quoted me, say, 3,000 Rand, and I walked out and it was 10,000 Rand.
Mm-hmm.
And, nobody likes bait and switch or sticker shock. And, since this is save your money, save your teeth, I know there'll be people listening to this that maybe do that, and they're not going to like what I just said, but I'm just repeating what I've heard from patients and that I've seen. I've seen the invoices and I've seen the quotes. And yeah, you are entitled to charge for that. Like we are entitled, we could charge an extra 3,500 Rand for our CBCT because of the machine and the cost of the machine, and that's what the going fee is, and 2,500 Rand for a 3D scan. But because it's already sitting here and we're using those things for other purposes, we don't actually charge for that. That's just the way we roll, yeah.
Okay, and doctor, if my dental situation is complicated, can digital dentistry still handle it effectively, or is it better for simpler cases?
I was hoping you were going to ask that question. Digital dentistry is actually fantastic for complex cases. When multiple teeth or entire arches need attention, the digital scans let us plan everything in a unified and 3D environment. If we're placing multiple implants, we can virtually map the positions to ensure the optimal spacing for long-term stability. The AI also helps us anticipate problems that might arise due to bite forces. In fact, the more complex the case, the more helpful digital tools become, because you want, every detail captured accurately so the final outcome is as seamless as possible.
And then, doctor, does going digital lower the risk of human error, like misfitting crowns, so I'm less likely to need future fixes?
Yeah, look, it does. And we kind of touched on that. We're all human, and even with the best intentions, manual impressions or like some guesswork in designing can introduce slight inaccuracies. With the digital systems, we capture things very, very accurately in the mouth, and the software designs the restorations to those precise measurements. This cuts down on the margin of error. When we get a milled Emax veneer or a zirconium crown back from the lab, or even when we mill it ourselves, the fit is phenomenal. 10, 20 years ago, I wasn't getting crowns fitting as good as that. And every time I do these things, I'm always amazed. If things fit better the first time, they last longer, or you don't have to remake them. There's less discomfort on your end. The things we expect, and we do see them lasting longer. Essentially the digital tools help us get it right the first time, and that's what everybody really wants.
Exactly. And then how might emerging tech like augmented reality improve my experience during complex procedures?
So there's a lot of talk about augmented reality. They're using it a lot in the universities for teaching. We don't have any augmented reality tools at OptiSmile yet, but I've seen demos, where augmented reality could let us overlay digital information into a live view of your mouth. So imagine a procedure where, say, you're doing a root canal treatment and you're looking through a microscope, and in the microscope, there's a built-in augmented reality, a digital overlay with the X-ray. So when the dentist is doing the root canal, he can actually see the file progressing virtually on a virtual image that's superimposed with your actual tooth. It's something like I had a prostate cancer surgery 6 years ago, and I had a robotic surgery, but it brings me to the subject of a prostate biopsy, where they use a virtual or augmented reality. When they're doing the biopsy, they overlay the MRI with the actual ultrasonic scan, which is live, and obviously they clamp on special instruments that then locks everything into position, and there's no guesswork. If they see a problem in your prostate, they can guide the biopsy, so they got the best chance of finding the cancer on the biopsy, or even telling if it is cancer. And it would be the same thing in the mouth. In medicine, there's a lot more money in it, so the development has been more rapid. Doing a root canal versus a prostate surgery is obviously one's life and death, and the other one is your tooth. So that has gone further. But there's even, I've seen special robotic augmented reality systems that you use augmented reality glasses, and it helps you to place an implant virtually in the jaw. It won't let you go out of line. But we've got 3D printed guides which do the same thing. So I'm not sure for the cost of those units how far that's going to go. What I'm really looking forward to, which will be amazing, is the AI overlay, and perhaps even augmented reality and preparation for inlays and onlays, where it guides you exactly where the decay is, or where you predetermine the preparation of the tooth should be, and even maybe little robots that will do the preparation while you're printing the restoration, because it knows the two talk to each other. It knows what the hole's going to look like before it even drills it.
Amazing. It's like a Star Trek movie, eh?
yeah
Into the future.
Unreal, eh?
Yes, no, it's unreal. I'm actually speechless. But apart from what you mentioned to us just now, looking ahead, why should we be excited about where digital dentistry is heading now, and how will it benefit us, the patient?
Well, I'm very excited. Every 2 years, I mentioned, there's the IDS in Germany, and all the latest equipment and tools and all of that stuff is launched, and there's new updates on the Invisalign equipment. One of the biggest competitors, 3Shape. We don't have a 3Shape scanner, but with this new scanner that just got released, I'm very keen to get one of these. It's only 600,000 rand. It's a little cordless thing. I say only because that is a lot of money, but I was literally drooling over some of the new features in this scanner. It is an upgrade on what we're using, but then Invisalign also launched some new things which are truly amazing, where all of these things will overlap. Your X-ray, your scan, everything all in one system. The software will triangulate or even use 4 or 5 different sources. And not only will it show the dentist, using white light or fluorescence or near infrared imaging, it will actually use something called hyperspectral imaging. It looks like it might even end up being better than X-ray. At some point, maybe we won't even have to do X-rays to find cavities. And it does like a printout. So what I find the most exciting is you just scan a QR code with your phone, and your entire report is visible in an app. It will open up an app on your phone. So within seconds of doing the scan, you have a whole diagnosis there and then. I think that will open up a lot of opportunity to drop costs. I can see, going to clicks and scanning 20 people and giving them their report without even having to come to the dentist. They'll know what's going on in their mouth via an app. I think that's where the future is going. And these, as I say, they're cordless. And the people demoing it at IDS, they had scanner races where the sales reps were just scanning themselves in a mirror literally in seconds. The iTero is amazing. We can scan a whole mouth in just a few minutes, but with this scanner, with your mouth closed, it's like sucking on a lollipop. You just wave it around in your mouth.
Wow.
And the next thing, in seconds, you've got a they call it DX Plus. It's got AI powered diagnostic engine, caries detect. It gives you your tooth wear analysis. It measures, actually with measurements, your gingival recession. We can see that all on our scanner, but actually this scanner gives a full report and measurements, and then it puts it in the app. Oh, and what's even more amazing is normally we got to stain your teeth with purple dye. You chew on a little tablet and you spit it out, and then it makes your plaque show up, and then you got to go and brush it off. This does it virtually, where you don't get a purple or a pink mouth. It will show a model of your teeth and show where the plaque is. So in one scan, you're getting all of this stuff, and then this app, this dental health app. Yeah, I mean, I am a big fan of Invisalign technology, and I hate to be, pushing the competition, but if anyone from Invisalign is listening, you guys better get on it. And I see here the Trios 6 enters the market at $27,900. So figure that out. That's a lot of money.
Yeah, that's a lot of dollars.
Yeah.
Oh my goodness. Yeah. But Dr. Yudelman,
what's that, about 600,000? So in South Africa, that will be 900,000 because we just pay.
Yeah.
We just pay extra for everything. Yeah. So
exactly. This has been very, very interesting, Dr. Yudelman. Thank you so much once again, and we appreciate it. So thanks for teaching us about all these interesting and futuristic things.
My pleasure. And I was wondering what we're going to talk about next week, but in talking to patients, I'm always coming up with ideas, and then I realized that I haven't done one about what's something called parafunctional habits. So everyone knows about nail biting. So nail biting, lip biting, tongue biting, cheek chewing, ice chewing, these types of detrimental activities. I think that calls for a podcast all on its own. I'm sure there's people listening, nudging their partners and saying, yes, that's you. You got to listen to that one. So
exactly.
We did one about clenching and grinding and snoring.
Oh yeah, I remember.
Apnea, but we haven't spoken about those things, so that should be interesting.
Sounds great. Dr. Yudelman, thank you so much once again. And also to our listeners, thanks for tuning in and joining us here on the Save Your Money, Save Your Teeth podcast with Dr. Clifford Yudelman from OptiSmile. Also remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. And don't forget to subscribe for more enlightening discussions. Join us again next week as we continue to explore the fascinating intersection of dental health and also financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.